Hello class, welcome to Social Work 502, Human Behavior in the Social Environment 2. This is Dr. Benavides, your professor for the course. In this video, I'm going to review the course expectations, primarily the major projects and assignments for the course. Hopefully you've become familiar with Canvas and the Canvas course pages, so this should not look that unfamiliar to you. If you click on this link, it's going to take you to a page where it gives you a little bit more information about myself. I also, under module for week 1, uploaded an introduction video to myself. So this course is 7 weeks long, and if you go further down, you will see that every week has a distinct topic with learning, with an introduction, learning materials, including required readings, required videos, anything that is required. And then under Engage, you will see the different discussions and assignments that are due for that week. All right. So, initial discussion posts, unless otherwise noted, are due on the Thursday of the week in which they are assigned, and response to one or more classmates. You want to make sure that you read assignment guidelines to see how many classmates you need to respond to are due by Sunday of the assigned week. Now, sometimes that can change. So it's really due dates, how many individuals, classmates to respond to, and length of initial post and response post. Those can change. So it's really important that you check the specific instructions for each discussion post. Now, under major projects and assignments, here's some information for you regarding the major assignments for this course. Of course, as I discussed, there are discussion forums every week that are part of your grade. In addition, there are 3 major assignments. The first is the condition presentation, and then there's a clinical vignette. And clinical vignette has 2 sections. Part 1, which is due the Sunday of week 4, and Part 2, which is due the Sunday of week 6. Now, the conditions presentation, this is an assignment that will be in small groups of 2, sometimes 3 individuals, depending on the size of the class. This will be either due week 5 or week 6, depending on which condition presentation you have signed up for. So let's talk about the condition presentation first. The condition presentation is 10% of your final grade. You are each individual student will be required to sign up for 1 mental health condition by the Sunday of the first week of the course. You will work on this presentation with 1 other student. The mental health conditions that can be available are anxiety, generalized anxiety disorder, post-traumatic stress disorder, anorexia nervosa, bulimia, binge eating, gender dysphoria in children. If you choose any of these, then your presentation will be due by the end of week 5. If you choose substance use disorder, neurocognitive disorders, and/or personality disorders, that condition presentation will be due at the end of week 6. You will need to go under people. On the left side of the screen, you will see in the Canvas course page, you will see a tab that says people, and when you click on people, there's going to be an additional tab that says groups. Under the groups, there will be a list of mental health conditions, such as the ones that I've read from here, and you are to choose one of the mental health conditions that are available. Somebody else in the class will also choose one, will choose one that you have signed up for. As I said, depending on the number of students per class, it will depend on how many presentations we actually have. Some presentations might have 2, the majority will have 2 students, some might have 3, depending again on the number of students that we have in the class. Now, each pair of students will utilize this PowerPoint template. You click on here, it'll take you to the template to create a presentation on the condition that you and your partner or partners have chosen. You are to work together on this presentation, okay? Now, you're both to choose different sections of the presentation to work on independently, and then you are to bring it together onto the PowerPoint presentation. So there's 4 sections to the presentation, which should be no longer than 12 to 16 minutes in total. So that means that each student would do a 6 to 8 minute presentation, and together would be between 12 and 16 minutes. The 4 sections are an introduction and of the topic of the condition that you have chosen, and showing a brief 3 to 5 minute video from YouTube of a person with a condition. The next is present a summary of a scholarly article related to the condition. The third part is to present a national website that national website resources and provide a brief tour of each website. You must together put a reference page slide that includes references for the entire presentation. So while the presentation will be completed together, each student will be graded individually based on your role. Please note that students will receive an automatic 0 for videos that are uploaded to YouTube instead of Canvas Studio. If you are having difficulty using Canvas Studio, make sure to reach out to technical support for assistance. So all oral presentations are due either week 5 or week 6, again, based on the presentation that you've chosen. So if you look up here, if you chose one of these, it would be due at the end of week 5. If you chose one of these conditions, and it would be due at the end of week 6. All major presentations will be submitted in 2 locations. One in the major projects and assignments module. This is so that I can grade your presentation, and in a discussion posted for the week after your due date. If your presentation is due week 5, post it in the week 6 discussion for your condition, because your classmates will be viewing and commenting, providing a response to your presentation. Okay, so now let's talk about clinical vignettes, part 1 and 2. Clinical vignette part 1 is due on the Sunday of week 4. It is 20% of your overall grade. Now, for clinical vignette 1, this, or for both clinical vignettes, I guess, for the assignment in total, this requires you to select a person whose subculture is different from your own. This should ideally be a current client. However, this should be a previous client or a current client, but it's not a client. You're not going to involve the client directly in this assignment. So under no circumstances may you interview, assess, or question a current or past client for the purpose of this assignment. Okay? Doing so will result in an automatic 0 and disciplinary action for ethical misconduct. The information for this assignment must come from written records, case notes, and or your best recollection of the client's characteristics and the details of the client's case. If you do not have a current client or a past client, and you've not worked with clients to choose or to utilize one for this assignment, you are able to use a case from a book you've written, a film you've seen, a TV series. So you are able to do that. However, you are not able to use family or friends for this assignment, and the Anita and Danny case examples that we use in this course, as well as other courses that you've had, cannot be used for the case vignettes either. So if you don't have a current or past client, you are able to take a character from a book, from a TV show, from a movie, something along those lines, which you must make sure you discuss what you've chosen with me. Okay, so clinical vignette part 1 includes the following: an introduction, where you explain your role with a client and in what context you work with this person. The data sources, where did you get this information that you have about the client? Any identifying information, age, gender, race, sexual orientation, and so on. You can read it all here. The presenting problem. This is a concise description of the presenting problem. What was the problem that the person came for to see you? The chief complaint. As stated in the client's own words, using quotes when possible, present a summary of the client's view of the situation. You'll have to be creative if this is not a client and you're using this from a book or from another source of literature or from a TV show, but you would want to find, but still, this all still applies. The history of the presenting problem. Okay, you want to answer these questions. Describe in detail the history and context of the problem situation. Is the problem of recent or long-standing origin? Describe the course of the problem development. When did the presenting problem begin? Did the person request help, or were they mandated to receive help, and what is their expectations for help? Then you will go into their psychosocial history. You'll talk about their background, their strengths, supports, resources, and your view of the situation. You'll also look at the current diagnoses and medications of the client. And you will begin a diagnostic assessment. And for this clinical vignette, you will do a clinical, in the clinical vignette 2, you will go further, but you're going to start the diagnostic assessment in clinical vignette 1, where you are to address the behavioral manifestation, signs and symptoms of the client, B, the risk factors, and C, identify 4 possible diagnoses, each from one of the family categories of diagnoses that we have discussed so up to week 4, which is neurodevelopmental, schizophrenia spectrum and other psychotic disorders, the depressive disorders, or bipolar disorders. Okay. Now, very important that you make sure that the individual client that you have chosen for this assignment is somebody that you can do a clinical diagnostic assessment with. In other words, it has to be somebody that you're able to assess for a DSM diagnosis. It's not somebody that you could say, oh, they just came in for housing problems, but there's no mental health issues. That's not going to work. It has to be an individual that you're able to conduct a clinical diagnostic assessment using the DSM. Okay, so clinical vignette part 2 is a continuation of clinical vignette part 1. As you know, in clinical vignette part 1, or as I just talked about a few seconds ago, you will be including A, B, and C of the diagnostic assessment. In clinical vignette 2, you are going to continue the diagnostic assessment. But I do want to just really make sure that I point out that you want to copy and paste the material from vignette part 1 up to the ABC, because that was part of vignette 1. Include that. However, update anything that needs to be updated as needed, including and especially the diagnostic assessments part A, B, and C, which were at the end of vignette part 1. Make sure that these are updated, because as you remember, for vignette part 1, you were only looking at possible diagnoses from the diagnoses that we discussed in the first 4 weeks. For vignette 2, anything that is part of the DSM that we have discussed through the course or that's part of DSM can be included as a possible diagnosis. You will also then include a differential diagnosis, a ruled out diagnosis, and a primary diagnosis. Now, these things might not make sense to you right now, but they will as we continue discussing these concepts throughout the course. You will also do a summary. I will talk more about this assignment as we go throughout the course.